Hello, everyone. Thank you for joining today's webinar, Supporting Veterinary Professionals' Mental Health Through a Peer-to-Peer Community, in collaboration with Togetherall and sponsored by Western Financial. My name is Denise Charon. I am the Manager of Membership Services at CVMA, along with the staff liaison for CVMA Veterinary Wellness Advisory Group. I'd like to introduce our first speaker, which is Dr. Kathy Kyle. She will introduce herself along with our upcoming speakers. Thank you, Kathy.
Thank you, Denise, and thank you for all that you do for the CVMA. Hello, everyone, and I second Denise by saying thank you for joining. My name is Dr. Kathy Kyle, and I'm speaking with you from the traditional territories of Treaty 7 in southern Alberta, where I am honored to live, work, and play. As Denise mentioned, I am chair of the CVMA Wellness Advisory Group, who is putting today's panel discussion / webinar on. And I will be your MC today, and I would like to recognize that it's important to highlight mental health and the mental health continuum in our veterinary work as veterinary professionals. And today we are in for an honor to hear stories about the perspective of veterinary professionals as they share their journey in mental health, and also how peer support can be instrumental in providing a safe space to feel heard, validated, and encouraged. The webinar will also highlight a mental health resource which is available to all CVMA members and student veterinarians that is called Togetherall. It is so important to have open dialogue on mental health, and I'm such a strong advocate of mental health and well-being in the veterinary professional. Yet I recognize that hearing and thinking about mental health, and particularly trigger warning, suicide and suicidal ideation, can be unsettling at times. So I do want to reassure you that you're not alone in these feelings, and we do have a number of safety resources available to you on the webinar. Soon we'll have a Wellness Advisory Group member join. Her name is Danielle Miro, and she'll be our safety support today. So if at any time you need to just reach out and chat with a peer, she'll be available in the chat to start a one-on-one private conversation. And on the screen, we also have a number of safety resources and considerations. If things get overwhelming for you on the webinar / panel discussion today, take a step back and take a deep breath. I am so honored to have 3 guest speakers today in the panel discussion. We will have time for questions, so please place your questions and/or comments in the chat, and I will be monitoring the chat. And at the end, I will report the questions back, and we can have some discussion. So we have Mary Lynn Kiefer, Smokey Walters, and Dr. Josh Cousins. And I'd like to thank all of you for joining today. And I'll start by asking a question, which is to tell us a bit more about yourself and your experiences, particularly being open and talking about your own mental health. So I'll start with Mary Lynn Kiefer to start. Thank you, Mary Lynn.
Thank you, Kathy, and thank you all for being here today. It's an honor. I am not a veterinary professional, but I am the Senior Manager of Partnerships at Togetherall, and we are hosting today with CVMA. As Kathy mentioned, Togetherall is a resource that is available to all CVMA members, and I highly recommend checking out the platform if you haven't already. I did include the link in the chat, but just wanted to give you all a brief introduction. So prior to joining Togetherall, which is a 24/7 clinically moderated online peer-to-peer community, I've been in the mental health space for the last 5 or 6 years. I previously was at a mental health not-for-profit, so this is a topic that's near and dear to my heart. I got into this space from personal experience. I was actually diagnosed with obsessive compulsive disorder back in 2017. I can say today, fortunately, I don't, deal with too many symptoms. It's something that I do manage. But it was something that, living in Canada, going through the mental health space, I realized that there really are, challenges in, the services that we have available, that there's a lot of barriers still. And so community peer-to-peer support is something that I really leaned into along my own personal journey. And which is why I decided ultimately to put a lot of my, energy and work into really creating, putting all of my advocacy into trying to help those in need. And I will say for those joining, mental health is a spectrum. And so whether or not individuals are dealing with a specific condition or going through just a tough time, whether it's work related, going through, individual situations like divorce or, a sickness, it's a spectrum. And so I'm glad that you're all here, and I look forward to the discussion. And I will turn it over to Smokey to introduce herself.
Thank you so much, Mary Lynn. Well, like so many people born and raised in the 70s and 80s, I grew up in a home affected by alcoholism and was the recipient of emotional, psychological, and physical abuse. And as such, I began receiving counseling at a young age at 6 years old through school, and was introduced by Alateen by a friend in junior high. And this was my first experience with peer support groups. So with that support, I did lose a classmate in high school to suicide. And as a reaction to that, I took a suicide prevention training course and then started a suicide prevention peer support group in my high school. I was fortunate as a teenager, despite living in a very abusive situation, to have really caring teachers and counselors at school who recognized how unhappy and difficult I had it at home. I was also really grateful for some mentorship and care that I received from my karate classmates and volunteer instructors, many of whom helped keep me away from my volatile home most days of the week, and also gave me jobs during the summer to keep me safe at that time as well. I ended up moving out of my home as soon as I finished high school, and then supported myself on minimum wage jobs until I could complete my short education as an AHT and get into the workforce. Unfortunately, my first job in the veterinary field brought me to an isolated community and an employer with a similar background to mine, who was really hard on their staff, both emotionally and psychologically. As I was ill-equipped to deal with the stressors of my new profession, along with an unsafe work environment, I spent many days leaving work crying. But I received really good mentorship and peer support from one of my work colleagues, and this was crucial in helping me get through that first 9-month job. I left that one and found myself struggling in another similar situation at my second place of employment. However, this time I had no peer support to help me, and I was morally distressed for most of my time there. So after spending another few years jumping from one workplace to another, I finally did find one that provided me with safety at work and a place to thrive both personally and professionally. And it was during this time of peace and growth that I began volunteering more actively in my professional communities. And I also learned that a lot of people with hurtful behaviors are often unaware of the effect that they have on others, and that they are often survivors of trauma themselves. So since then, to help foster a sense of mentorship and support in my own profession in the veterinary community, I take all of the time that I can afford to connect with people authentically and where they're at, whether it be at work, at social events, veterinary social events. I took the ASSIST course in 2017. I formed the Edmonton Association of Small Animal Veterinarians Peer Support Group in 2018. I took peer supporter training in 2021, and then mental health first aid in 2022. And I'll talk more about the ESAV, which is the short form for the Edmonton Association of Vets. I'll talk more about that a little bit later. Thanks.
Thank you, Smokey. And we'll turn it over to you, Josh. Thank you.
So hi, everybody. I am Dr. Josh Cousins. I'm a small animal practitioner. I'm currently practicing up in Prince George in northern British Columbia. My experiences with mental health were not at the result of an abusive situation or anything external. I was very fortunate in that way to have supporting parents. But for me, the abuses were more internal. They were things that my own brain would tell me and stories that I would write about myself. And so in undergraduate, that's when these kinds of toxic thinking behaviors really started to push me into a deeper form of depression and eventually into suicidal ideation. Thankfully, this was recognized by my parents that I was not acting myself, and was able to be intervened and start to see counselors to try and start working through that. I did some work on that prior to going into vet school. And then of course, in vet school, those problems became an issue again. Thankfully, there was a wonderful counselor by the name of Erin Lawson, who was working at the school at that time, and she really helped me to work through a lot of those thinking patterns and really try to dismantle them so that they were no longer creating the same kinds of problems that were leading me to such a self-destructive place. After going through this journey of going so low and then finally feeling like I was on the better side of recovery, someone whom I know had from my childhood ended up dying by completed suicide, unfortunately. And I found out about other people who had come close to suicide, but had thankfully been either had family members intervene or it had a change of decision at the last minute. These kinds of stories made me realize, and especially because these stories only became aware to me after I had gone through these struggles myself, and my people close to me were willing to talk about those things, made me aware of just how unfortunately common some of these things can be, and just how little when we talk about them, often for perfectly respectable reasons about it being very difficult subject to talk about, and sometimes unfortunately because of feelings of shame and guilt surrounding them as well. So as someone who felt like I was on the opposite or end of this journey and being able to make it into a better place, I felt that it was part of my responsibility to be able to share that story so that other people can hopefully feel validated and know that there is a progression and there is another side, even if you're in the deepest of that valley. And so that's why I'm here today.
I am just so grateful for the openness in all of you and sharing your perspectives and your experiences. And it reminds me of a rising singer here in Alberta. Her name is Haley Benedict, and she some of her songs are about being an advocate for mental health, more in the teen space, yet her lyrics are applicable to all of us. And something that you just mentioned, Josh, is resonates with me on her own lyrics, where she says, have a voice. So to be open in the telling, when your voice is strong enough, you never know who you will help. And to me, that just helps us to level set and in a way level up, that if we're open about where we're at in our mental health and where we've come from and where we are on the mental health continuum, it just means that others know that we are the type of person that they can share back with, and we can just have really authentic, as you said, smoky conversations. So I, again, appreciate the sharing, and I would like to maybe shift our thinking to, and we'll start perhaps with Mary Lynn, to tell us a time where peer support was helpful for you, where you were able to access it and find that it did help maybe your thinking or where you were at in your mental health continuum.
Yeah, for sure. So yeah, as I shared, I was diagnosed with obsessive compulsive disorder in 2017. And at the time I had been, dealing with symptoms for a couple of years and really didn't know, I knew I was struggling and I knew it was mental health related, but I didn't know that it was OCD because of just how we see it perceived in the media, and how OCD presented for me was quite different through, intrusive thoughts and compulsive, a lot of mental compulsions. And so it was not external. So it was something that I dealt with by myself for quite some time. There was some shame, but there was also this inability to really articulate what was going on because I didn't understand it myself. And so, it got to a point where I could no longer sustain it. And I kind of, hit a wall and was like, I need to get help. And so I did go through that journey initially through, the doctor, et cetera. And although treatment was wonderful and continues to be something that I rely on through therapy, a friend of mine that was in the UK, living in the UK at the time and had dealt with her own mental health challenges, had recommended joining a peer support group. And at first I was like, I don't know if that's for me. I would feel really uncomfortable, amongst strangers essentially. And but I was like, I need to try everything. I was really in a place I had to walk away from my job at the time. And it was really, I was just focused on getting better and recovery. And so I decided to try it out. I looked up, I'm in Toronto, so I looked up a few options. And at the time, these were in-person peer support groups that were in the Toronto area. And I went, and this one was specifically, again, to the topic of OCD. And I can honestly say, like, at first it felt weird, you know, just being in a group with strangers, but within a few minutes of hearing other people sharing what they were going through, and me feeling like for the first time through that 3 years of just pain and suffering, like, oh, I'm not alone. Like, what they're sharing is very similar to my experience. And immediately that just took off this weight that I had been feeling like I was the only one that had this brain that was like, you know, like similar to Josh, what you were saying, like just kind of torturing myself. And it wasn't an external, everything externally was fine, but my brain was just, it was sick. And so to sit there and feel like for the first time I felt seen and felt like I wasn't alone, it was something that I really value. And that then took me on the journey of, you know, getting approached by an OCD specialist in the Toronto community to, you know, ask if I would be interested in facilitating a group. And so I started to facilitate on a volunteer basis, and I still continue to do that about once a month, and now they're online. And then it ultimately brought me to Togetherall because, you know, like I said before, I think therapy and everything is also necessary. But this community approach and having a place that you can access at any time of the day and talk to peers about whatever you're going through is something that I really and truly believe in so much. And so I'm just grateful for this new, this opportunity to work with Togetherall, and this opportunity here today to hear from Smokey and Josh as well about their experience with peer support. So I think I'll leave it there. And we will have time for questions at the end as well. So if you do have any specific questions for any of us, we'll take them at the end.
That's wonderful. Thank you. And we will have the opportunity to talk a little bit more about the Togetherall platform, which is a free resource available to CVMA members and student veterinarians. And Marilyn will be able to go through a little bit more on the platform, and I'll put the link in as well on how we can register if you haven't already registered for the platform. So I'll transition now to Smokey, and if you could tell us a little bit too about where peer support has been helpful in your life, maybe on both sides as a receiver of peer support and also all the incredible things you do for the ESAV peer support group.
Well, Kathy, I did already touch on a little bit about some of the support I had received as a teenager. I'm afraid that, I don't know, I suppose the pivotal support that I received would have been in that first safe workplace that I had worked at. The veterinarian who owned the practice at the time, she also had lived with alcoholism growing up and recognized kind of where I was at and how much I was struggling. And she was very, very good at just giving me that safe space and allowing me to thrive and supporting me where I was at. And I can't say, I think without those people, I was so fortunate, you know, despite having such a terrible family, I was so supportive. I was so supported by my teachers and my colleagues and, you know, different people that I had encountered throughout my career. And I just can't say how much that helped me to heal. And I'm still healing. I'm almost 50, and it's going to be a lifelong process to heal from that rocky start that I had. Now, I did want to share, though, I do provide quite a bit of peer support to my colleagues over the phone and in person. And I wanted to share a story which was so poignant that, with all of you. Now, she had been working at a clinic and that became quite toxic throughout the pandemic. It was such a stressful time for everyone. People had to call in sick a lot. You know, they weren't very good at canceling appointments, and it was a busy practice. And her life became more and more difficult because she had lots of kids and had to call in sick constantly. And one of the staff members was just very, very mean. And so she ended up having to go on stress leave. And after realizing that she didn't think she'd be treated well or supported when she went back to that clinic, she decided to go to another clinic that she had previously worked at, who had been very supportive of her. And while she was working diligently to get past the trauma that she'd experienced for those 2 years, it happened one day that a locum came into the practice who had worked at that other practice. And this was a trigger for her. And she found herself face to face with this person who you know, by no fault of her own, it wasn't anything that she had done, but just the presence of that person from the past place put her into a panic attack. And she was just losing her mind inside. And fortunately, a very observant coworker of hers, and I mean, she'd only been in this practice for a couple of months, so this is phenomenal. This coworker, who I believe had taken mental health first aid, recognized that she was really struggling internally. She came up beside her, put her arm around her shoulder, gave her physical support, and whispered, "How are you doing? Are you okay?" And she was like, she just kind of shook her head, because she was in the middle of a conversation with this person that she didn't want to know was affecting her in this way. She didn't want to offend that person. So this colleague just kind of helped talk her through this little conversation she was having. She kind of made an excuse to back away, walked her into a room where she could be by herself, where my friend could compose herself and kind of, you know, have a little breakdown and figure out what the heck is going on. And she just was so derailed by having that instant panic attack. She had no idea where it had come from at first, but she managed to compose herself. And then she went right away and had a conversation with her manager to let them know of the problem. And they came up with a way for her to feel safe while this locum was going to be in the practice for the next couple of days. And the management was really supportive. You know, they did not judge her. They just gave her what she needed to get through this situation. And I can't say how proud I am of our profession and our professionals who are so aware and are becoming so supportive of everybody. Because as we all know, we all struggle. We all go through periods of tough times. We all deal with mental health problems. And, you know, I myself have suffered from suicide ideation for many, many years as a teenager. And I get myself through my hard times, and I struggle all the time as a mother, as a professional, as a wife, even as a friend. So I'm just I wanted to share that story with you because I found it just made me feel so happy to hear that. Thank you.
It's a beautiful story, Smokey, and it makes me think of how there's such an important interplay between who we are as individuals and the experiences we've had as people. Also, the interaction we have with the workplace and what that culture of the workplace is and how people come in and out of workplaces. And we, like the story that you shared, we may have had past experiences with them where they weren't positive. So a few thoughts, and I've taken the mental health first aid course twice. The first time I took it was a game changer. And then I took it during COVID because it was online, it was accessible, and it still is available online. It's a small cost. You can find the mental health first aid open enrollment course in your community. And it gave me a better understanding of what those signs may be of someone who is struggling. And to your point about the self-awareness, in a study evaluating veterinarians and where they're at with their psychological distress, 60% of veterinarians, and I would think this is fairly comparable to veterinary professionals, said they would feel comfortable talking with a peer in their work environment about sensitive and important issues. That is great, 60%. Yet we do have an opportunity. We have that gap of 40% who maybe they wouldn't be comfortable either with past experience or maybe having been dismissed or judged or stigmatized by others. And so there's an opportunity for all of us to become more self-aware and to have some of that skill set in our toolkit on what to do if we do see a colleague struggling. So thank you for that, Smokey. And I'll transition over to Josh now.
Thank you, Kathy, and thank you, Smokey, too. Yeah, for me, a lot of my help for my own personal journey came from more one-on-one counseling with mental health professionals as opposed to peer support. But I did get some when I know more indirectly when I heard stories about other members of my family who had incidences with close to suicidal ideation or things like that. And I know for me personally, providing peer support, I've had a colleague who was struggling with aspects of the limitations of general practice and was really struggling with whether or not this was the right field of medicine for them to be in. And in just being able to be there as more or less a sounding board and as someone who could appreciate and understand the nuances of what general practice is, that was very helpful for them in making a decision about where they wanted their career to be and what would fit best with their expectations for what they wanted to do with their skills. I think for me, though, the most important experience that I've had with peer support came kind of suddenly. And this was after a few years of me being more open about my own experiences with depression and suicidal ideation, talking about that openly at home and trying to be more comfortable just talking about that myself. I happened to be up one night, and about 1 a.m. I received a phone call from a family member, and I answered it, and they were in a period of emotional distress at that point. They were feeling very overwhelmed, and because I had talked openly about my experiences, they knew that I was someone who they trusted to talk to about this, because I was someone who might be able to understand in a way that they were not sure anyone else would, at least not in their immediate circle. Because I had had some training with mental health, first aid, and peer support as well, I was able to help that person kind of coax them down from a very highly agitated state to begin talking a little bit more about what we wanted to do going forward, creating a safety plan, and starting to work towards an end goal of getting us to a better place. And this person ended up doing quite well. They engaged with their family, they engaged with mental health supports as well, and they're in a much better place here. But I'd already known that being able to share my story and be someone who could be there to help provide that support was important, but that experience very much solidified my confidence in the value of being able to provide that kind of level of support, even if you're not a mental health professional, understanding the limitations and the barriers of where that should be. But, I don't know what would have happened had this person not reached out to me. And maybe they would have been fine and maybe not. So I'm very happy that I was able to play any kind of role in supporting that person. And I think that's something that a lot of us can do if it's safe for us to do so.
Agreed. I think many of us, if not all of us in the veterinary professional world, were solution providers. That's sort of what we're trained or hardwired to do: diagnosis, assessment, plan. And when I learned through various courses and lived experience to have some skills around peer support, it was reassuring to me that I didn't need to be an expert. So if someone comes, for instance, and I'm a peer supporter on the ESAV peer support network, if someone comes and says, I'm struggling getting back to work after a mat leave, the clinic has changed, there's new staff, and it's even being purchased by a corporate, I don't need to have been in that situation myself to provide support and reassurance and encouragement, nor do I need to know any of the answers. In fact, the tenets of peer support is not to provide answers, that the person reaching out for peer support likely knows the way forward or knows the way forward that is best for them. And we just provide reassurance, encouragement, ask curious questions, and maybe in the conversation, in that dialogue, they realize, oh, maybe I should do one more thing, or I should talk to another person before they go ahead and make a decision or make a change. So thank you, Josh, for sharing that. And the other thought too I had is, we're on a continuum. For some of us, peer support will help us, whether it's peer support with another veterinary professional, or the type of peer support I love on Togetherall is because I have anxiety. I'm on Togetherall interacting with other people who have anxiety and worry. So there's that aspect of peer support, yet we have a continuum of services available to us, including, and I see a counselor on a regular basis. The two dovetail nicely together. So it's never peer support or counseling or talking with a professional or our GP. It's really where we're at in our lives, our situation, and what we're going through. And I think the two dovetail so nicely together, or like that continuum of support. So I will, I believe now, perhaps ask a question to Mary Lynn, if you can share a little bit more about the Togetherall platform. And in that, I think you're showing a few slides as well. And I can place the link again in the chat for people to register to the Togetherall platform.
Yeah, for sure. I can do that. But I think you had one other question you were going to ask the panel, just specific about the veterinary professional.
Right on.
Profession.
Thank you, Mary Lynn. Thanks for keeping me honest to the agenda here. The question is, why do we think veterinary professionals, veterinarians, RVTs reach out for peer support? So Mary Lynn, I'll start with you first, and then we'll move over to Smokey and Josh.
Yeah, I mean, given that I'm not in the profession, I'll, you know, keep my answer brief here, but I think in general, you know, we're seeing an increase in mental health related issues. I think in particular in certain professions, I know in particular within the veterinary profession, we're seeing an increase in mental health related challenges. And so I think in all of those cases, you know, and when I show you the Togetherall platform, we do have a group specific to veterinary professionals. I think in some cases, people do want to come and chat with individuals that are in the same industry as them because you're likely facing similar challenges, or you want to just chat with someone else that's, you know, not in the profession that, you know, you can really chat about whatever it is that you're dealing with. So I think in general, I think, you know, yes, we have our support network as individuals, whether it's through family and friends, but we often see through the Togetherall platform in particular, often people say it's much easier sometimes to have these vulnerable conversations with strangers and in an anonymous way through the platform. So yeah, I think it's likely going to be just stressors, whether it's in your personal or professional life, but can't really speak to too many specifics on that industry, just given that I'm not in it. So I'll turn it over to Smokey, unless you had anything to add to that, Kathy.
I think thank you for, you know, stepping in from the Togetherall, wearing that hat. What we know from the stats of people who have joined the Togetherall closed group for veterinarians, Canadian veterinarians and student veterinarians, everything is confidential and anonymous. However, we do notice that 30% of the people who have joined are early career grads between the ages of 25 and 34. And Mary Lynn, to your point, the digital asynchronous online platform available 365, 24 hours a day, 7 days a week, may align really well to that, to the younger early career grad from maybe a timing perspective or feeling the safety of going on and typing and getting things off one's chest, and then other people respond. So then there can be that, well, I'll check back in and see how my comments resonated or how other peers are supporting. Thank you, Mary Lynn. And Smokey.
Thanks. Well, speaking to why our professionals reach out for peer support, I can't speak for why other people do it, because I think that the reasons are often multifaceted and really depend on their personal circumstances. But I can tell you why I reach out for peer support. And it's because I appreciate so much what someone with my shared and lived experience can bring, and how well they understand and relate to the pressures that I face as either a veterinary professional or even as a parent, for example, or say a musician, because I'm also a musician. And it's funny, I had a great peer support conversation with my brother, who's also plays the same instrument that I do. And it was just so great to hear him say, yeah, this is really stressful. And I back you right up on how you're feeling. And like, it was amazing how that empowered me and made me feel so much better about the stress I was feeling about my music. Knowing that others do struggle with the same problems that I do makes me feel like imperfection is okay. And that feeling like a failure is normal sometimes, and that not having all of the answers doesn't mean that I can't find them. As someone who grew up in an alcoholic family with my mother had bipolar, I was a perfectionist, and I was constantly trying to people please and just trying to be the best that I could be and get straight A's and do everything perfect so that people would love and accept me. And I've learned since having my own kids that that's actually not important, that it's more important to be happy. And it's funny because I struggled so much in early practice, probably for the first 5 years of practicing medicine, to be perfect at work all the time. But because I was trying so hard to be perfect and to do everything the way everyone expected me, I burned out and I became kind of toxic in a way. I wasn't bringing my best personality to work. And it was a big eye opener to me when I saw somebody else come in who was not what I perceived as perfect as a tech. She made lots of mistakes, and they were little stupid mistakes. They weren't serious mistakes, but she was really happy and she was fun to be around, and people wanted to work with her. And I realized at that moment in my career that, you know what, being happy and bringing my best happy self to work is probably more important than being the best tech and cleaning walls when I'm slow and cleaning out those cupboards when we had time. And so I actually made an active decision to stop giving 125% of my ability at work, to only give maybe 75% most of the time, which was still like way better than what most people brought to work. And I just tried really hard to be happy and fun. And you know what? I started making more money. I started getting more job offers, and my life completely changed after that. So I have to say, and it's with peer support that I learned these things, not through psychotherapy. It wasn't, and which I've done a lot of. It was through peer support. And then now that I'm a parent, I'm trying to teach my kids the importance of happiness versus perfectionism. And I also try to instill a sense of belonging, connection with everyone that I meet. So when I'm reaching out for peer support, what I'm looking for is someone who supports my intelligence and wisdom by using active listening to help me identify what I'm struggling with, and by trusting me to find my own solutions to my problems. When they do that, it leaves me feeling empowered and eager to face my challenges, rather than feeling like running away and hiding and crying in the bed. So I'll turn it over to Josh. Thanks.
Thanks, Smokey. And Josh.
Yes, thank you. Yeah, and in keeping with Smokey's very wise mantra not to put words into other people's mouths, I'll do the same and say, for me, I think the kind of advantage of peer support coming from someone in the veterinary field, if you were to talk to someone else from the veterinary field, if you're struggling with mental health issues of any kind, especially if these are ones that you're not familiar dealing with, I think it can be difficult talking about them with people outside the profession, because not only do you have to explain these feelings, which may be difficult for you to get a grasp on, but then you also have to explain the context of the work situation to another person as well. And that adds another layer of difficulty on explanation on top of the difficulty of explaining something you may be going through for the first time. I think the advantage of talking with someone for the veterinary profession is you cut out half that conversation, and you just have to focus on the part that is new and uncomfortable for you. You don't have to explain what it's like to be a vet, to work long hours, to go through appointments, to deal with euthanasias, whatever it is that are the particular stressors to your experience as a veterinarian. You can already work knowing that that person has some level of experience with that, which really cuts down on your workload of having to explain that, in top of explaining, I think, a much more emotionally challenging subject like, your own mental health or your own mental health struggles. And I think that's where a lot of people, at least again, see peer support as that kind of first place to start talking about things and to maybe get a bit of a better handle of what they want to do, and if they do want to go look at more professional support afterwards. But being able to have some of those initial conversations with someone who maybe isn't as intimidating as a fully clinical psychologist or a mental health professional, but is seen as someone who's just a closer friend, and the conversation is less like, help, I need help right now, which sometimes it is, but sometimes it's just, hey, I really need to talk to just somebody about this, not as a clinical, like, I need your diagnosis, but I just need you to listen to me. And I think that's where the value of peer support really comes in.
Thank you all.
So I think, Kathy, I'll just go through a quick demo of Togetherall. And then I know that Smokey was going to share a little bit about another peer support group that's available. But, Togetherall is available for free to all members of CVMA. So, really want to highlight that we included the link a couple of times through the chat. So if you haven't registered, please check it out. But Togetherall is a safe, scalable online peer-to-peer mental health community. One of the really unique features of the community is that it is licensed. It's monitored and moderated 24/7 by licensed clinicians. And so licensed clinicians are there all around the clock to ensure that the community remains safe. And you are able to directly, reach out to clinicians if that comes up. And it's like I said, it's an anonymous platform. So of course, there still are, although we are trying to reduce the stigma around mental health, there is still a lot of stigma. And so to be able to go on as an anonymous individual and share your own mental health experiences, like Oliva said, you know, it's such a spectrum, any challenges you might be going through in life, it is really a safe and inclusive online space for you to do that. So I'm going to pull up the actual platform here. Okay, so give me a minute. So like I said, the community is monitored and moderated 24/7 by licensed clinicians. And the clinicians are really there to make sure that the space remains safe. Of course, there's going to be certain things that come up, maybe talking about suicidal ideation, et cetera. So the clinicians are there to intervene, especially in those situations where there may need to be a further escalation process and further support that's required. So, you know, it really is that space to make sure that if anything does come up that does need further attention, clinicians are there to kind of help out. And also to be able to, you know, if you are looking for additional resources that might be more specific to something that you're going through, the clinicians can also point you in the right direction in terms of potential other resources that might be available to you. So as you'll see, you know, it kind of looks similar to like a Facebook group or, you know, something like that. So it's very easy to navigate. In the right-hand corner here, my anonymous username is dragonfruit22. And so this anonymous name, you'll be prompted to create one as soon as you log in and register for Togetherall. And it is, you know, so whenever I post anything, whenever I'm replying to anything, dragonfruit22 comes up. So nothing, Mary-Lynn doesn't show up at all. And then in the bottom right-hand corner here, you'll see Ask a Wall Guide. So a wall guide is our nickname for a clinician. So at any point you can directly reach out to a clinician, and they also have the ability to directly reach out to you if they have anything specific that they would like to chat with you about. And, you know, Togetherall has been around for about 14 years. It was first founded in the UK. So it was really, you know, at the beginning when Facebook was a thing and was just becoming a thing. And so we have, you know, millions and millions of people. It's a global community. So people around the world that really create vibrancy in this community. So you're going to have people talking about, you know, a whole list of various challenges that they might be facing. And depending on, you know, what it is that you want to chat about, maybe you don't want to chat at all. Maybe you just want to read about certain topics. This allows you to kind of identify the areas that you're most interested in. So it could be, you know, anxiety, it could be, you know, stuff on relationships, addiction, grief. And so it kind of just helps you to narrow down what might be a particular interest to you. And then you can also just go to like the search field and type in, say, OCD, and then there'll be any conversations about OCD that have happened, and then you can kind of go in there and have a look at what people have chatted about. As I mentioned, there are specific groups for various professions. So like Josh mentioned, you know, if there is something that you want to talk about that's very specific to the vet profession and you really just want to speak to other people in the industry, you can go to the groups here and then you can join the veterinary medicine group. And then you can go in there and specifically chat about challenges. But like I said, there are some individuals, because we have a lot of people in the healthcare industry on here, for example, and they're really more so interested in some cases, you know, just chatting with a stranger that's, you know, not in that group at all. So yeah, I think that's it. It's a very user-friendly platform. And like I said, it's very vibrant. So you have a lot of conversations going on there all the time. And I think, like I said, the unique feature is the whole idea of the clinicians that are readily available to you, that are really making sure that it remains a safe space. So yeah, I think that's it. So I'll turn it back over to you, Kathy. And I know that you've had some, very specific, I know you shared already, you have gone on the platform and, you have used it for your own kind of looking at and chatting about anxiety specifically, but would love to hear a bit more about your experience on the platform.
Yeah, thank you so much, Mary Lynn. And from my experience being in that closed group, it feels so supportive and reassuring. And people share from all different experiences of vet med. It can be from job challenges or a combination of job challenges and balancing or getting some harmony between work and life. The comments are so supportive, and it's also great to be on and just see someone saying, hey, how's everyone doing out there? So just asking those open questions and saying it is okay to share. Because it's anonymous, then there's that element, I think, of safety. And I really appreciate the fact that we have clinical oversight of a mental health professional, which some of the other peer-to-peer programs which are available for more like asynchronous programs which are available to veterinary professionals don't have that element of safety. So to me, that's very reassuring. And the other consideration too, when it comes to Togetherall, is for all of us, if we are CVMA members and student veterinarians, do register, even if we're at a point where we may not need peer support, knowing that we can go on, depending on where we're at in our career and where we're at in our life, and provide peer support. And peer support is simply responding back in an encouraging, reassuring, and supportive way. So we can be on Togetherall for a number of reasons, including giving and receiving peer support. And then do consider sharing the link to sign up for Togetherall, and it's free of charge, thanks to Western Financial, to other CVMA members and student veterinarians as well. So I will now transition to Smokey, so Smokey can share about the Edmonton Association of Small Animal Veterinarians, which is a mouthful. So we shorten that down to ESAV, Peer Support Group.
Thank you, Kathy. I am so excited to see what the CVMA has brought for veterinarians. I think it's a very, very valuable resource. And yeah, big thanks to Western Financial for supporting that financially. Mary Lynn, am I able to share my screen? Because I could show people just our website and how to sign up as well. Kathy is going to share a link once I start talking, but I just thought I'd ask.
Yeah,
Okay.
I think Kathy will just have to give you the hosting ability.
Okay.
Sorry, Denise. Denise will have to just give you the hosting ability.
Okay. While she does that, I will. I'll just
tell
everyone.
You can go ahead.
Thank you. I'll tell everyone a little bit about the Edmonton Association of Small Animal Vets. So we're a local continuing education group, similar to the Calgary Academy of Veterinary Medicine and some other small groups that were sprinkled around Ontario and some of the bigger provinces. We provide continuing education seminars, usually in person, in the local community to help foster a sense of collegiality amongst veterinarians. So that, and the goal when they founded this back in 1971, when there were only 4 veterinary clinics in the province or in the city at the time, the goal was to keep them collegial so that if they ever had challenging cases, they could just call their buddy down the street and ask for help. And so this organization has grown, and we now have associate memberships all over Alberta, Saskatchewan, and BC. We provide continuing education on Zoom. We record all of our sessions and provide a video library. And we also still have collegiality events, so social events, so that veterinarians can connect with their local, their peers. And we've opened up membership to veterinary technologists as well. And back in 2018, when we were recognizing that veterinary professionals were struggling with mental health issues, with the help of Dr. Martin Schiebel, who was a volunteer on the board at the time, he and I created the ESAV Veterinary Peer Support Group. It was an in-person group meant for veterinarians only for the first 2 years. At that time, we were able to provide valuable support to a few colleagues, some who came to meetings for months on end before ever feeling comfortable enough to share, and others who only came when they were on the verge of a crisis or in need of urgent support. We stopped meeting at the beginning of the pandemic in person and then quickly changed to a Zoom format. And once we realized that there wasn't a national peer support group, we got permission from our insurance company to open the group up nationally. So it is available nationwide. We struggle with advertising that to the whole country. But since Dr. Schiebel's time, and he had moved on, but since then I got the help from Kathy to recruit a whole bunch of more veterinarians from across the country. So some of whom are in attendance today. So we have veterinarians ranging from the whole gamut of lab medicine and people from small animal backgrounds across the country, some from Ontario, Saskatchewan again. And we also have another technologist who is really interested in peer support, who helps facilitate our sessions. So this is a true peer support group. None of us are psychologists. We're not trained to provide psychological assistance other than what we've taken from mental health first aid. Some of us have taken peer supporter training, and some of us have also taken the assist course. So we do have some training, but we're certainly not mental health professionals. But we do provide peer support, and we do it monthly on Zoom on Sunday evenings between 7 and 8 p.m. Mountain Time. And I'll just show you quickly, if I share my screen here, I'll show you our website, and Kathy's going to put the link to sign up on the chat for you. But if you go to www.easab.ca, and there are lots of peer support resources available from the Alberta Veterinary Medical Association at CVMA, but we also have some up on our website just in case people need more. So if you go to Community Connections, this is all public here, Community Connections and then peer support group, there's some information here about when our peer support group meets, when the next meetings are going to be. And there's also a list of veterinary professionals who have put their phone numbers out there for any veterinary professionals in the country who want personal support anytime. So you could call any of these people anytime that you want to. We may not answer, but we'll get back to you if you're looking for personal support right now, preferably not at 2 in the morning. But again, we would get back to you if you needed some support. And sometimes people are just more comfortable with a private conversation rather than coming face to face with a bunch of strangers. I have no problem with strangers, being a musician and a performer. So I put myself out there very easily, but I recognize that a lot of people are very introverted and they do not like that kind of situation. So this is why we have all of our numbers here for people in case they want some support. And then also, if you want to receive links to these meetings, to the Zoom links to the meetings, all you need to do is click on the sign up button, and you can sign up and create a profile on our website to get our emails. Or if you'd prefer not to do that, you can scroll down to the bottom and just subscribe to our newsletter. So you can click on the subscribe button. It'll bring you to this very simple page where you put your name and you can make up a name if you don't want your real name there. Although I do like to make sure that people on our website are veterinary professionals, and I sometimes delete people who have funny looking names. So just keep that in mind. If you're getting emails and then you don't get emails, just maybe reach out by emailing me and contacting me through the contact button down here at the bottom of the website. Are there any questions about the ESAB peer support group?
Yeah, that's great. Let's open that up. If there are any questions about the ESAV peer support group, either place it in the chat. We are at the point right now where we can open it up to questions and take questions. So while I let people reflect on any questions regarding ESAV, there was a question more in general about the differences or the value of having a formal peer-to-peer program in an organization with identified people who have signed up to be a peer supporter. So someone in need in that work environment would know who to go to, or should the peer-to-peer support be more informal? So if I can put that question first to Mary Lynn, and then the rest of us can comment if need be.
Yeah, I mean, I think, you know, I know different organizations have like mental health champions, mental health advocates, where colleagues, professionals know who those identified people are, and so they feel safe that that individual might be trained with like mental health first aid, for example, and they can go to that person for, you know, specific peer support. So I think that's always a great program to put into place. Obviously a bit different amongst the veterinary professional given the structure. I think the one challenge sometimes with creating peer support groups within, like, you know, an organization is sometimes that lack of being anonymous. And again, because it's within the veterinary professional, it's not like everyone's in one office and you really know people. So I think there is still that a little bit of a sense of, you know, not knowing and not being in the day-to-day of with a colleague. But yeah, I think it's going to be based on an individual preference where they feel most comfortable. Like I said, like Togetherall platform allows people to log in from their phone, you know, when they're out for a walk, for example. But if people do more so want that face-to-face, I think that, you know, that can also be highly beneficial as well. So I don't know if that really answers the question, but I do know that oftentimes within why Togetherall is a global community is some companies have said, oh, well, why can't we have like a group just for our company? And that the issue is that then people tend to not feel as comfortable to open up because they just want to remain kind of unknown to other individuals.
Thank you. And I think that reinforces the value of having options from peer support. In a way, wouldn't it be great, just like we have a physical first aider in every single work environment or every single veterinary work clinic, wouldn't it be great to have a mental health first aider? So in those situations where people would feel comfortable reaching out to someone in a less anonymous or still confidential way, they would have that option. And to what Josh had said earlier, to have people a little bit more, and Smokey too, a bit more aware of signs and indicators to recognize in others, to reach out and to say, are you okay? Or, you know, or what help can I provide to you? And then we have the continuum where we have, you know, Togetherall peer support, and then also the ESAV peer support where people can still join anonymously, yet it's more, it's live, it's more synchronous. So I think having options is great. I'll turn that over to Smokey and Josh if you want to comment on, you know, informal, formal peer support and where those fit.
Josh, why don't you go ahead? Because I've already taken a lot of the com and we're running out of time.
Well, then I'll just be real quick here. But I think because of the breadth of the challenges that we're facing with this profession in terms of mental health, I don't think redundancy is our biggest issue right now. And as Smokey alluded to, like there's a variety of different reasons why people seek out mental or peer support. And there's a variety of reasons why people seek out and need mental health support. And their journeys are all going to be individually different for exactly how they are going to conquer that problem. So making sure that there are a variety of different types of resources out there so that each individual can hopefully find the best path forward to their own state of recovery. I think that is one of the most important things we can be doing right now, and appreciating that diversity in solutions to this problem that our profession has been facing.
Thanks, Josh. I'm just looking to see, we're kind of coming up to 2 minutes to the hour. I was just typing to someone who asked about status of being retired and no longer a paid member of CVMA and whether access to Togetherall is available. And I know we have some amazing folks from CVMA on the call. My understanding is one would need to be a current member of the CVMA. There's likely a lower cost for retired members in order to access Togetherall. So currently it is available to CVMA members and also student veterinarians. However, recognizing that accessibility and open access to peer support is so important. That's one of the gratitudes I have that Smokey is on the line to talk about the ESAV peer support program, which is available to all Canadian veterinarians and RVTs free of charge. So we're offering options from a wide inclusive Canadian veterinary community. I also see another question, can vet assistants who are veterinary technicians apply? They're often very challenged as receptionists, etc. Yes, absolutely. I recognize and agree that there are challenges widespread. In fact, data shows that support staff have higher rates of psychological distress than veterinarians in a 2022 study. However, the relationship that CVMA has with Togetherall as an organization, as Mary Lynn said, is for CVMA members and student veterinarians. It doesn't mean that vet assistants or RVTs wouldn't be able to have access to Togetherall. As a group, though, and Mary Lynn, you can correct me if I'm wrong, as a group, an organization would need to come forward to start that conversation with Togetherall.
Yeah, and we have started that conversation. As we know, it is something that is in need. So, you know, stay tuned, and hopefully it can, you know, be opened up to the broader profession. But yeah, yeah, that's it.
Thank you. Thank you so much. And we're coming up to the top of the hour. I recognize that all of us have very busy lives. Thank you so much for joining. I appreciate the openness to listening and to sharing. If you do need any support after this, please consider either talking with someone you trust in your social network. Also, from the employee assistance plans that many VMAs have, there is availability for licensed psychologists or mental health professionals, and then do consider joining the peer support group if you have any leftover mental health questions or topics that you want to discuss with peers. So everyone, stay safe, have an open heart, look after yourselves and look after each other. Oh,
I'm just gonna jump in and say one thing. I put in the chat, if you did have any, if you are interested in sharing details about Togetherall to colleagues, or students, etc. I put in my email in the chat, so please reach out directly. We do need some, champions out there that are really out there on the floor talking about this type of thing. So please reach out directly. I'll add my email again, just so it's at the bottom of the chat.
Wonderful. Thanks, Mary Lynn. Yes, if we can increase the utilization rate for CVMA members and student veterinarians on Togetherall, that would be so wonderful and amazing. So let's all do this as a community. And thanks again for sharing stories and being open in the telling. Very courageous, thoughtful. Smokey, Josh, Mary Lynn, thank you so much. And take care, everyone. Have a good rest of the day. Be safe.
Thank you. Bye.
Thank you. Bye-bye.